Hi guys. I did my in-service on strokes and stroke rehab. Before I get started, I would just like to apologize. I'm doing the best I can with this recording, so just bear with me throughout this. So some questions to consider. What types of strokes are there? What does acute care therapy consist of after a stroke? And also, how can strokes be prevented? So I'll start out with a stroke, and what is it? So a stroke happens when the brain or parts of the brain is deprived of blood. So this prevents the brain from getting oxygen, nutrients, and ultimately leading to the death of brain cells, and can occur within minutes. The two types of strokes are ischemic. So this is when the brain's blood vessels are narrowed, or they can be blocked from fatty deposits that have built up. It can also be caused from a blood clot or debris that has gotten lodged in the brain. The second kind of stroke is hemorrhagic. Hope I said that right. This is when a blood vessel in the brain leaks or it ruptures. It can be caused from hypertension to taking too many or too much anticoagulants, an aneurysm, trauma, as well as an ischemic stroke that can also lead to a hemorrhage. Initial treatment. So this is right after a person is diagnosed with a stroke. Typically they are in a hospital, they have had a head CT and all of that. So once a stroke and the type of stroke is determined, the doctors will then make a treatment plan. Some of the treatments directly after a diagnosis may include IV medication. These include like blood thinners if it is from a blood clot. Sometimes they will go in and remove the clot, do an angioplasty or a stent, and sometimes they'll do surgeries such as clippings. And I have a video here. Oh, of course it's not gonna work. Give me 1 second. I'll just play it on here for you. So I found this video and it is from the Cleveland Clinic. So it goes through a little bit about what a stroke is, as well as something really cool that they have that helps diagnose strokes.
It's really important to raise awareness of what stroke symptoms look like and how to recognize stroke if a family member has a stroke. FAST, which is face, arm, speech, and time, so FAST. Look for droopiness of the face, droopiness of the arm or weakness of the arm, trouble speaking, and time, which is of essence in acute stroke. So the sooner the symptoms are recognized and the patient makes it to the hospital, the better the chances of recovery. The most important thing is not to waste time, not try to put the patient in the car, but to call 911. It's definitely a huge advantage of being in the Cleveland area because of our mobile stroke unit, which is an ambulance with special equipment to deal with acute stroke. It can be dispatched along with a regular ambulance. The mobile stroke unit has a telestroke unit on board, so a physician can evaluate the patient while being in the ambulance. We also have a CAT scanner in the ambulance, so quickly the brain can be evaluated. And the biggest advantage is that TPA, which is the clot buster medication that we use to treat acute stroke, can be immediately administered even in the ambulance. Usually when ischemic type of stroke occurs, there's some sort of blockage in a blood vessel of the brain that provides supply to a certain area of the brain. And if that blockage is not dealt with and not resolved, then that brain tissue will eventually have irreversible damage. The sooner that blood clot that's causing the blockage is dissolved, the better the chances of recovery. If there is evidence of large vessel blockage, then they may qualify for not only TPA, but something called mechanical thrombectomy, which is an endovascular procedure. We use very small catheters that we advance through the groin vessels all the way up to the brain. We're able to pull out the blood clot with the help of the little catheters. It's important to note that while TPA has time restrictions, mechanical thrombectomy may be available for other stroke patients, even with extended windows based on advanced imaging. Based on the severity of the stroke symptoms and how efficacious the therapy or the treatment was for the stroke is going to determine how long the patient will have to stay in the hospital and how good the recovery is going to be.
Sorry, I'm going back here. Okay, so I thought that video was really cool. I didn't know that like mobile stroke units existed. So when I saw that, I thought it was a really good concept to be able to diagnose. So rehab for strokes, the start of the rehab or therapy depends mainly on the type of stroke that the patient had, as well as how the stroke was treated. So whether it was treated surgically, through medication, the way it's treated can change the way that we rehab a stroke significantly. Stroke treatment also takes into consideration the age of the patient, as well as the area that the brain that was damaged and the overall condition of the patient. If the patient is in the ICU and their vitals are extremely unstable, we are going to approach that very differently with therapy than we would with someone whose vitals are stable and they are awake and alert and oriented. So typically though, in stroke patients, they like to start therapy within 48 hours after the stroke is diagnosed. Some types of rehabilitation. Post-stroke patients may need a variety of therapies. This isn't just including physical therapy. Stroke patients sometimes have difficulty with speech, so they'll be assessed and seen by a speech therapist. Speech therapists also they do like swallow studies. So if a patient has difficulty eating or anything like that, they will take them down to x-ray and they will actually watch them swallow different consistencies. So there's like a liquid and a pudding, and they'll make sure that they're not choking on those things, and they'll make a diet for the stroke patient. Occupational therapy typically sees stroke patients just to make sure that they are able to do their daily tasks, such as brushing their teeth, brushing their hair, and using the restroom. And then possibly if the stroke is, I don't want to say bad, but depending on how the stroke affects the patient, they may also be seen by a respiratory therapist as well. So acute care therapy, once a patient's vitals are stable and medications are adjusted, physical therapy can typically work with the patient. In a hospital setting, I know right now at the hospital that I'm at, if we do have a stroke patient, we typically call the nursing station to make sure that the patient is appropriate. We also like to check with the doctors just to make sure that the patient is okay to be seen. Making sure vitals remain stable during a therapy session is very important, especially since a lot of times stroke patients are put on medications. They not only can affect just the overall like mental status of the patient, but it can also affect blood pressure and heart rate. So if the patient's vitals are already unstable, if they are on medications that can affect those, you really want to keep an eye out on those. And depending on the status of the patient after the stroke, like I said, if they're in the ICU, we're going to approach therapy different. So we may just begin with active assistive range of motion to see how they tolerate something like that. Acute care therapy continued. So determining the treatment plan for the day, it is important to take into consideration the patient's level of function, their level of alertness, and their mental status. So if I go in to treat a patient that has had a stroke, and they're a very low level of function, I'm probably not gonna just get them up and walk them to the bathroom, especially if they're not alert and aware. I would definitely start with lower level activities and work their way up just to see how they handle it. Also, strokes can not only impact a person's level of alertness, but they can cause emotional issues as well. So I actually have a stroke patient currently that they are having a lot of emotional issues. So sometimes when you go in to treat them, they'll be very happy, very ready for therapy, and then other times you walk in for therapy and they just break down and start crying because of how frustrated they are, which is very normal and common for stroke patients. If it is determined that a patient is ready to get out of bed for therapy, it is extremely important to keep track of their vitals when changing positions, especially if they are already known to have issues with their vitals. So typically, you want to take blood pressures. If they are supine, start the blood pressure in supine, and then if you sit them edge of bed, take it edge of bed. Just monitor it throughout the different positions that you have them in. If you're thinking about working on gait and ambulating them, definitely take their blood pressure when you stand them up, just to make sure it doesn't drop or skyrocket. So acute care therapy continued. So a lot of times in acute care for therapy, physical therapy and occupational therapy will do a co-treat. So they'll both go in together for this treatment. This allows for them physical therapy and occupational therapy to work with the patient. So physical therapy can work on balance, strength, coordination activities, while occupational therapy can work on daily self-care tasks. So physical therapy takes the patient to the restroom. A lot of times if the patient is sitting on the toilet, if they're not able to use the bathroom while they're in the bathroom, occupational therapy will be like, hey, do you want to wash your face while you're sitting here? Do you want to try to brush your teeth? Things like that. This co-treat is really good if the patient requires more assistance and has a lot of lines, because while one therapist is working with the patient, the other therapist can be managing those lines and making sure that nothing gets tangled, keeping an eye on the patient's vitals. This also, having a co-treat, is good because of the emotional instability and just being overall fatigued. This makes it less likely for stroke patients to turn down a therapy session because they get both sessions in one. So if physical therapy goes in and gets the patient up, they're less likely to turn down occupational therapy if occupational therapy were to go in after physical therapy, and vice versa. So being supportive and encouraging is very important for post-stroke patients. This doesn't just come from the therapy team, but also family members as well. This can help with the patient's mental health. Tasks that are typically performed in the acute care setting most of the time are just basic tasks. So balance activities, you can have them stand up if they are having issues with their balance, have them stand in a walker and just you can literally put gloves inside of another and tie them and make a little ball, and you can toss it to them and see how their standing balance is inside of the walker. Obviously, this would be better for a co-treat. That way someone could hold on to the gait belt to make sure that the patient doesn't lose their balance and fall. Any activities reaching outside of the base of support, you can take them on walks just to assess how they walk. Do gait training and just basic strengthening. Strengthening exercises can be done in the bed, where the patient can do them whenever they want, as well as if you get them in a chair and they sit in the chair for a few hours during the day, they can do those seated exercises while you're not in there. Standing exercises can be done as well. It's just important to tell and inform the patient, as well as the patient's family, that a member or staff member of the hospital has to be in there when the patient stands up, just for safety reasons. Education is extremely important for patient safety and awareness. Making sure that if the patient does have balance and gait issues, that they're not getting up by themselves. And just if they do require an assistive device, making sure that they're educated on it. If you're having them do like sit to stands, just making sure they're reaching back for the chair before sitting, because a lot of times stroke patients can be very impulsive. Education to the family is very important as well, especially if the patient is wanting to be discharged or expecting to discharge to their home. It's important that their family members know how to assist them and help take care of them and help keep them safe and prevent falls. So post-acute care, so after the patient is discharged, they may go to like a rehab facility, which a lot of times is really good for the patient because they'll get intense rehab and it helps with their balance, strength, and coordination. That way they are better off when they do go home. Or they may be discharged to home. If they're approved for like home health care, they can have therapy and occupational therapy go to their house and work with them. Or if they are higher level, outpatient therapy may be an option if they're discharged home. So with outpatient rehab, it's a little more advanced, and the patient drives, well, they wouldn't necessarily drive themselves, but they would have to have transportation to the rehab facility. So the goals are still the same. It's to improve balance, coordination, and strength. So patients in outpatient therapy typically have more things they can work with. So they can use like parallel bars. There's more equipment such as like TheraBand to continue to progress with strengthening. And outpatient rehab typically is around 3 days a week, depending on how insurance covers it, as well as how many times the patient is recommended to go. So then I just have a little slide on stroke prevention. So controlling blood pressure is very important. Hypertension increases risk of stroke. Exercise and weight management, keeping your cholesterol low, heart disease prevention and screenings is really important to prevent strokes. Managing your diabetes, if you do have diabetes, avoid smoking. And then I actually found that medications such as hormonal birth control are associated with increasing risk for stroke because they do increase your risk for blood clots. And then here is my works cited. And I also put the link for that Cleveland Clinic video on there as well. I hope you guys enjoyed my presentation. I hope you learned something. And if you have any questions or anything you would like to add, please feel free. I would love to learn anything that I can about this topic. I've had quite a few stroke patients in my rotation, and I actually got to see a stroke diagnosed in the therapy room, which was very strange. They were in a treatment session and they had a stroke and neurology was called, and they were literally diagnosed within the hour. So if anybody has anything else to add, please feel free. Thank you.